your body will actually start ripping it out of your bones to use, because you got to have it. Your body needs it to use. That's what your bones are. One of the things your bone do is to store calcium, so your body has calcium stores to run off. If you don't have enough calcium coming in through your diet, coming in with vitamin D, your body will start to rip it out of your bones. So this is why vitamin D is so important, along with proper calcium, keep you away from osteoporosis, so you don't start ripping calcium.
Is that why the bones get brittle?
That is why the bones get brittle, because you don't have enough calcium coming in, because the body needs calcium to run things. And if once the bones get too brittle, the body has to start making choices, and so it starts shutting systems down. And that's why you start to get sick. Other things start to go haywire, because you only got enough calcium to run one, and unfortunately, the bones come last, because you don't need bones to live. At least, it's not a great life to live without bones, but you definitely need calcium. If you want your heart to beat, you gotta have calcium. If you want your nerves to function, you gotta have calcium. And without those two things, there's no point in having bones. Here's the levels at which they can prevent rickets. 99% of rickets is preventable with serum levels of around 19. So, and that's where they kind of set the standard at. So, I mean, you can see that that's pretty low. Most people, especially kids, if they're drinking, they'll easily hit those marks, and won't have rickets. But it's a ridiculous thing to know. So that's why we don't have a real high prevalence of rickets anymore. We've gotten our vitamin D levels up to around 19 or so, especially in the summertime. Kids will be way over that. They're doing anything playing in the sun. Of course, if you're staying indoors more, playing video games more, watch, you might see a resurgence and stuff like that.
Hey Ken, was that test? What was the name of that test? Was that on the screen? The 25-OH?
Yeah, 25 hydroxy D. Yeah, that's the test you want to have done. Yeah, blood serum level.
Okay, thank you.
Yep. Infectious disease, cold and flu. One of the things that big buzzword too over the last little bit. 2,000 IUs a day. This is a study someone did. 2,000 IUs a day reduced prevalence 80 to 90% of cold and flu. That includes things like H1N1. So simply keeping your vitamin D levels up will keep your immune system healthy enough to the point where you won't, get the cold or flu. If we do a little history, tuberculosis. One of the old tuberculosis treatment was put the people with TB in the solarium and they let them sit in the sun, and it worked. Got people better. And why did it get people better? The sun turns cholesterol into vitamin D, and vitamin D fights infection. Another interesting fact about infectious disease is that, especially flu season, tends to hit us into the fall and winter. We have a massive drop in vitamin D because the summertime's over. We used to get the vitamin D from the sun. Now we're not getting it from the sun. There's no sun anymore. Vitamin D levels drop, and then infectious disease like cold and flu hit us hard because now our body's not protecting us against it. That's why we have rampant flu season. Flu seasons in the south tend not to be as bad. Only the people that really stay indoors a lot tend to get hit by it. People that are out in the sun tend not to get sick. A couple of reasons how this works. Vitamin D acts as a strong antibiotic by helping to increase antimicrobial peptides in the body. Vitamin D acts on viruses and bacteria that are harmful to the system by naturally boosting our immune system. So, looking at that, we won't have a problem by using, if a lot of people want to use to fight infections, they want to use antibiotics and things to kill the bacteria. But what will happen is we'll end up getting things like rebound infections, especially things like thrush, which is yeast that builds up in the mouth. And if you've been on antibiotics, you get that real yeasty taste and that thick coating in your mouth after you've been on antibiotics, like when you wake up in the morning. That's yeast because there's no natural bacteria in your body to prevent that from happening. We have a lot of natural and good bacteria in our body that help us to function, especially in our digestive system. Helps us to break down food, also helps us to make vitamin K, which is important for blood clotting. And there's also a lot of helpful bacteria that live on our skin. So if we take in too much antibiotics, it'll kill all that stuff. And that's why people that are on long-term antibiotics end up developing what's called C. diff, Clostridium differens, I think it's what it's called. And it actually it's the #1 nosocomial infection, which is infections you get in the hospital because your body has no good bacteria to fight it off. And once you get this, you're done. Most people die from it. And it's one of the leading causes of death in hospitals, especially if you've been on antibiotics for a long period of time. So maybe getting your vitamin D levels up will keep it from having to go through that. Staph infection as well, especially on the skin. If you've been on antibiotics for a long period of time, it kills the natural bacteria on your skin too. That's why they like antibiotics for things like skin irritation, skin problem. But being on it too long might predispose you to have higher risk of staph infection because you don't have that good bacteria to fight that bad bacteria off, or that natural bacteria that your body's used to having to fight that off. Again, if we, a big topic, with vaccines, we're not really going to get into that today. But if you keep your vitamin D level at, high enough, you may not have to give your kids those dangerous vaccines that have the mercury in them, have the other kind of adjuvants in them that can be very harmful. And the word is still out whether or not vaccines are the problem with autism or with some of the other diseases that we're seeing kind of grow. But simply maybe getting your kids enough vitamin D, and even if they have had those vaccines, getting your kids enough vitamin D maybe will help them from not developing any problems associated with those things. Help their body to utilize that vaccine better or whatnot. But definitely something that if you got kids, you're gonna have kids, grandkids, definitely something that you want to look into. Cancer, this is a big one. Everyone dreads a big C. How does vitamin D affect cancer cells? Well, vitamin D is, like we said, it's a pro-hormone. It makes things happen. It makes things happen better. Things that it will do for your body. It will improve your overall cell function, how your body works, how cells function. When we see cancer, cancer is a problem with cell function. It's when the cells start to divide and they stop. They don't stop. They just keep growing and growing and growing. And they eat up blood supply, they eat up nutrients, and that's what ends up, things just get bigger and bigger and bigger and end up killing you for that reason. Vitamin C will help improve cell differentiation, which means it'll help improve the structure of the cell. It'll make the cell grow normally. It'll make the cell grow the way it's supposed to, and it'll help the cell come to full maturation. When you see cancer cells, they tend to just start dividing, and they don't differentiate at all. They just become cells, and they'll grow. Apoptosis, which is time cell death. Every cell has like an internal clock, and it knows how long it should live, and if there's a problem with that clock, it won't stop living. And so slower growing cancers, there's an issue with apoptosis, which is the kind of cells that they won't die. So they reproduce and they won't die, they reproduce and won't die, and you get more and more and more that you don't need. You're just making more and more cells that you shouldn't have, which is what we call proliferation. So increasing the rate of these two things will decrease proliferation, which is the uncontrolled reproduction of cells, in which inversely will increase the invasiveness of any cancer. If these things are controlled, it won't be invasive. If it's not invasive, it won't be metastatic. Metastatic is when it starts to move. You have a tumor and it starts to break apart and move to other parts of the body and spread. That's when cancer gets the most dangerous. Then you can't chase it anymore. It's in one spot. We can chase it down. We can irradiate it. We can, chemotherapy is a little more effective. We can cut it out. But once it gets to the metastatic point, it gets a lot tougher to fight. Angiogenesis, which is the formation of vasculature, and what tends to happen with cancers when they start to grow, the body wants to provide these cells with blood vessels. So they start to chew up a lot of our body's blood, a lot of our body's nutrients, which is why they start to make us so sick. This will decrease the rate of angiogenesis within these cancer cells, within these cancer needles. So we're not giving those cancers the blood supply they need to live and proliferate. So they can't exponentially get bigger because they don't have exponential amounts of nutrients from the blood. Because we kind of cut the blood supply off. Again, inflammation, which is a huge part in any type of disease, especially cancer. Decreased inflammation will help to control a lot of the pain associated with it and a lot of the problems that go along with it as well. Furthermore,